Hi, I'm Zorley, and I'm a student physical therapist at George Fox University. And today I'm going to be talking about self care and postpartum. So, first off, I want to start by saying once postpartum, always postpartum. If you've ever been pregnant, this information can help you. So, here's a quick outline. We're going to talk about some general tips and tricks for immediately after birth, movement timeline, and scar management. So, starting day one, there are 5 things we need to talk about. First, sleep whenever possible. Allow your body to rest. Second, vaginal care. Avoid wiping and instead try to use water whenever you can to clean your vagina. Also, using pads to control bleeding and ice packs to help control pain are a great thing. Third, nipple care. So applying lotion, oil, or just generally keeping your nipples hydrated during this time so they don't chap, it can be really helpful. Fourth, staying hydrated, drinking as much water as you can, and getting proper nutrition. Nutrition plays a super important role in the physical and mental health of a new mom. So much of your energy has been used in creating a new life, and a lot of the stores that we have are depleted in that process. So now it's important to build that back up. Some tips for getting good nutrition at this time are eating warm, digestible foods like soups and stews, decreasing sugar intake, and eating an increased amount of protein. Fifth, prevent constipation. The last thing you want to do after having a baby is straining to use the bathroom. This puts stress on the abdominals and the pelvic floor, which are both really stressed out after going through the trauma of birth. So instead, we want to help make pooping easier by making sure that we are eating lots of fruits and vegetables, being hydrated, as we talked about, and never holding our breath when we're trying to go to the restroom. Always breathing with um, with bowel movements. Also, moving around, making sure that you are getting up and moving can help with this process. And really, we're making sure to avoid straining and avoid constipation because that can lead to pelvic muscle strain and prolapse, which is that descending of pelvic organs, which is very uncomfortable. So we want to avoid that. So now we're going to go into our timeline of healing and movement postpartum. So in the first month to 2 months, we're working mainly on deep breathing and baby bonding. Deep breathing is going to help us get some of that core contraction back, it's that coordination of our pelvic floor and our core. We're going to go through that and how to do it in a few minutes. So let's talk about baby bonding. By lifting, carrying, feeding, snuggling, and playing with your baby, you are moving and you are getting the proper amount of exercise that you need during this time. So you get points for that. We're avoiding strenuous work and just focusing on breathing and spending time with your newborn. Quick note on pelvic floor contractions. The pelvic floor is like any other muscle of the body. You need a full range and want to be strong in that full range, which is why Kegling is something that can be beneficial, but it's not the solution to regaining strength of your pelvic floor or preventing leaking. Really, we like to use a fist example. If I'm just constantly squeezing my fist, I'm not actually strong. I'm just really tight. And so my fist will actually get really tired, and I don't have the motion that I need to be able to do my daily activities. You can try this out. You can't move your wrist as much when your fist is super contracted. Instead, you have to also be able to relax to get that full motion. So it's important to have strength in the pelvic floor, but it's also really important to be able to fully relax and get that full range. Otherwise, we're just really tight and those muscles are getting tired and not actually stronger. So we suggest pairing practicing contracting with breathing, which will be on the next slide. A note is about this though, if you are experiencing some urine leakage with coughing or laughing or things like that, you can practice doing a pelvic floor contraction and then coughing and then laughing and see if that helps kind of manage some of that leakage in this early time. So breathing practice. Taylor is going to come on the screen. She's laying down, getting in a comfortable position for her. There are some other positions to try on the right, so just find what's comfortable. Some might be easier for you, some might be harder, so practice in a few ways. She puts one hand on her chest, one on her belly. The hand on the chest, we want to stay pretty still, but the hand on her belly should move a decent amount. She should, as she breathes in, feel her stomach expanding and her sides, even down into her pelvic floor, relaxing down. And we are going to do 4x4 breathing. So she's breathing in through her nose for a count of 4, and then out through her mouth for a count of 4. So we're going to try it. Hand on chest, hand on stomach, breathe in for 4. Breathe out for 4. Practicing doing this a few times, a couple minutes every day, can be really helpful. And then if you would like, you can add in some contractions with it. So for that, you'll breathe in for 4 through your nose, expanding, feeling relaxation through your pelvic floor. And then as you breathe out, you're going to think about squeezing all the walls of your vagina and lifting up. And then once you breathe out for 4, you start again. You fully relax down and go again. All right, so in weeks 7 to 12, this is where no more vaginal bleeding should be happening, and it's safe to start exercising. Sexual activity can be resumed, low impact cardio, things like walking, gardening, and then also strength training, which we're going to talk a little bit more about. And the focus should be on core and hip strengthening. So we have 4 exercises for core strength that we're going to talk about. And then just a quick note about diastasis recti, which is shown here on the right. It's the separation of the abdominal muscles because the connective tissue in the middle gets a little bit loose to make room for baby. Totally normal. But with that, exercise is totally safe. We just want to avoid things that put an excess amount of pressure into the abdomen. Things like sit-ups or that's a great example. Sit-ups. We usually avoid that, or crunches, because as you come up, it puts a lot of pressure and you might see a little bulging or tenting kind of in the middle of the stomach where that connective tissue is still kind of loose. And it's not dangerous, but we just would prefer to do stuff where that's not happening so we can strengthen it better and keep it protected. So what we are going to do instead are these 4 exercises. So first is an exercise we call the dead bug. Amanda is laying down on her back, arms and legs in the air, and she's slowly lowering opposite arm, opposite leg, and tapping them down. Her goal is to keep her back really flat against the mat at all times. And we start with usually about 15 of these in a row, and then you can go more or less as needed. To modify, she is just doing her legs only or just her arms. So if the full dead bug is too much, these are great modifications to start with. So in number 2, Taylor is just getting into her front plank. She's going to try to hold this position for 30 seconds. Really with this, the goal is to keep the back flat again, making sure that butt isn't really high in the air or you're not sagging down. A way to modify is to go onto your knees, just like she's showing. And you do a front plank, but we also suggest doing side planks. It gets a little bit different area of the core. And a way to modify a side plank is, again, onto your knees, holding each of these positions for 30 seconds, and when you're doing side planks, making sure to do both sides. So the third exercise is just marching. This really will work on some hip stability as well as some core strength. Grabbing your baby or a jerry can of water or something that adds some weight is a great way to make it harder. And then to make it even harder, you can lay on your back, feet under you, bringing that butt up, and then marching in place while you're on your back. Start with 20, see how that feels. You can always do more or less of any of these exercises as it feels right. So then for 4, it's just lifting and carrying things. So grab some jerry cans, fill them with water, more or less water depending on how much weight you want, and then practice holding them, carrying them. You can try just holding them on one side and carrying them. That'll work the other side more. Practice lifting them in front of you or to the side. Really, while you're standing or walking and then using your arms like this, it's really going to force those abs to hold you up and practice stabilizing you. Perfect. So, hip strengthening exercises. We also have 4 of these. One note is that if at this point you're still experiencing some leakage and you want to work on more pelvic floor strength, this would be a time where you could start adding some contractions in with these exercises. So, for example, if you're about to do your squat, contract, do the movement, come up, fully relax. And then you can try that again, doing it a few times. A way to work on having that strength and coordination in a dynamic movement if you're noticing that when I do these exercises, I'm leaking. It would be an appropriate time to practice. So then as you get stronger, also you might want to add some weight, holding your baby, holding a jerry can, holding something while doing these leg exercises can help make them more intense, which will help get you stronger. So the first one is just a squat. So feet shoulder width apart, and Taylor is just bending her knees and hips as if she was trying to sit back into a chair. She's about to show you holding the baby while doing it, just a way to increase that resistance. And this is a way to make it easier. So getting a chair and actually sitting down or tapping the chair, make sure that it makes it a little bit easier, and then you have a little bit of a safety net behind you if you need that. So and then we have our second one is a hip rotator exercise. So Taylor's laying on her side. This is the easier version where her feet are together and then her top knee is going up towards the sky and back down. To make it harder, now she's on her hands and her knees and still rotating out one leg at a time, trying to keep her back as flat as possible. That rotation is all coming from the hip and not her back. So with both of these exercises on this page, 15 to 20 is a good place to try to start. Yeah, let's go to the next one. So third, we're doing a lunge. So one foot in front of the other, bends both knees, and her trunk is just going straight down. To make it harder, you can do walking lunges. So taking a step either forward or back and just walking while you do it. It makes it a lot harder. Trying maybe 10, 15 of these at a time. And then for the last one, we're going to do some single leg activities because this is really going to work on that stability in the hips. And so Taylor's showing us now just a single leg stance, making sure that she's not hooking that back leg. And now she is using one finger on a chair just to help with a little balance, which is totally fine if that's where she's at. Trying for 30 seconds on each leg. Now she's standing on a step with one leg and tapping down to the floor with the other leg. This is increasing the challenge by a lot, but it's a really good thing to work towards. Yeah, okay. Let's go to the next one. Perfect. So at 6 months, this is where usually you're able to start fully engaging in an exercise routine, get back to fast dancing, running, jumping, heavy labor, whatever it is that you want to do. A note on leaking. we've talked about it a little bit. I'm going to say it again. Leaking urine is common, but it's not normal. And Kegels are not the solution for urine leakage. For some people, if they're already tight, doing Kegels just makes them more tight, tires those muscles more, and makes them less effective. So, if you're finding you're leaking urine, work on breathing, work on fully being able to relax the pelvic floor, make sure you have that full range, work on that coordination of your deep core and your pelvic floor with that breathing. So practice the deep breath breathing we talked about: 4 in, fully relax; 4 out, contract and hold, and then go again. And then increase your hip strength. These muscles support your pelvic floor, so you don't want your hips to be weak, because your pelvic floor will try to do the job of your hips. And your hips muscles are a lot bigger and better at their job if they're strong enough. And so, really working on having good, strong hips so that they're supportive to the pelvic floor and not making the pelvic floor's job harder is our goal. Perfect. So, our last topic is scar management. We want to do scar management to make sure that it's healing as best it can, that the scar can still be mobile, that it is less sensitive to pain, and it's softer. But we want to make sure we do it. We wait about 6 weeks to do this because we want it to be healed enough that we can avoid infection or making the tear or incision bigger. So usually at about 6 weeks is when we start this. So with vaginal scars, we would do this for 5 to 10 minutes a day until the scar is as mobile as it needs to be, or it's faded or not as sensitive. So get in a comfortable position, however you need to be to relax fully. Try a few deep belly breaths, like we've practiced, to fully relax that pelvic floor. And then you might choose to apply a lubricant or a vaginally safe oil or cream, or do this in the bathtub so the water can help reduce some of that friction. And then you're going to use your thumb or your index finger to massage along the scar. So if this finger is my scar, I'm going to take my finger and I'm going to go in 3 directions. So across the scar like this, up and down on the scar, and then in circles on the scar. And you're going to be moving toward the anus in all 3 of these directions. Then you're also going to try inserting your finger into the vaginal canal and then stretching it lightly by putting some pressure downward toward the anus and on both sides and holding it for 15 seconds each. This is going to help to tackle some of that scar management from the inside and increase that mobility and decrease any tension. So for C-section scar, it's pretty similar. With this, you're going to get comfortable, apply a lotion or cream, or if you're doing this in the bathtub, some soapy water is great. And you're going to do the same thing, going along the scar, up and down on the scar, and in circles on the scar. With this one, you might want to do on the scar and above and below the scar too, just really getting that full belly, because that whole thing is probably pretty tight after having an incision. It's just kind of what happens. And then if you find an area that's really tight on the scar or above and below it or wherever you're massaging, you're going to hold that area for 30 seconds. You might feel a gentle release or an increase in mobility. Whatever you feel, that's just really helping to give it a little bit of a stretch. So with that, both C-section scar massage and vaginal scar massage, neither one is going to be super pleasant, but we don't want it to be painful. So a little bit of discomfort, kind of a stretchy feeling, that's okay. But if it's painful, you're probably pushing too hard. Back off, go lighter. We're really trying to desensitize it slowly. Just last slide here, we just want to thank you for watching. Remember, keep moving, breathe deeply, focus on hip and core strengthening, and we are so excited for you and for your family.